Hi there, it's Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. Today I want to talk a little bit about depression. Not specifically major depressive disorder, but depression in general. When people feel kind of depressed, oftentimes in the winter blues. There's also a disorder called SAD, which stands for seasonal affective disorder. And this time of year, where it's colder outside, there's less sunlight, people often can feel somewhat depressed. And what's important to recognize about depression is that there are a few different tracks that you can use to try to get out of it. So there's what's called cognitive therapy, changing your thoughts about things, and ultimately then feeling less depressed. But for many people, when they're depressed, they feel like it's really hard to do. And even if they're able to identify some of their unhelpful ways of thinking and replacing them with more accurate or more helpful ways of thinking, that it just seems ingenuine and unreal and not something that will actually help them. Fortunately, there's another form of therapy called behavior activation, which in short just refers to getting out and doing the things that you at least used to enjoy doing. The reason I say used to is because in depression many times there's a symptom called anhedonia, which is the loss of interest or pleasure in things that you used to enjoy doing. So even if you feel like you're not in the mood of doing this or that, or you don't see how that's going to make you feel any better, if it's something that you know in general or in the past was an activity that you did enjoy, go ahead and do it. And these are activities that can give you pleasure or enjoyment or a sense of mastery, like learning a new language, or a sense of productivity or fulfillment. And so that's another way to try to overcome depression, through the very much a behavioral route. People also tend to isolate when they're depressed, and social connection is another great way to get out of depression. So as you can see, you can take the cognitive route, you can take more of a behavioral route, you can also focus more on your social connections and try to engage socially even if you're not feeling it. And for most people, once they do, they at least don't feel worse and they usually feel better. For more about depression or anxiety, OCD, you can check out our website for our blogs and videos on these topics, which is ADOPsychologyCenter.com. See you there.